I had a nursing school student who DM'd me and said that they need some help about renal failure and kind of how to treat it, how to assess for it as a nurse. It kind of wasn't clicking for them. This sheet is actually from my NCLEX program in the nursing school review section, but let's go over it. So there's acute and chronic kidney disease. Acute means it just kind of happens out of nowhere. It's sudden. Chronic means it's like gradual, slow loss of kidney function over time, right? And chronic, there's like stage 1 where you have some damage, stage 2 where you start to have a mild reduction in your GFR. And then step 3 is pretty moderate. You're going to have a GFR of like 30 to less than 60, essentially. Severe is a GFR of 15 to 29. And then kidney failure completely is a GFR of less than 15 mLs a minute. And you need dialysis or you need a transplant. And we also call this stage end-stage renal disease. Signs and symptoms that you are going to assess for as a nurse is they may be fatigued and weak because of their anemia and just like the waste and toxins building up in their body. They're going to have swelling in their extremities. They're going to have some fluid retention, decreased urination because the kidneys are like, oh, we're not going to make some. They're going to have itching and skin disturbances because of all the waste circulating. They're going to have nausea and vomiting, shortness of breath if they have fluid backing up into their lungs. All right, now how do we treat these types of renal failure? So acute renal failure, you have to find out what's causing it. So there's something else that can be causing it. And then we're also going to be monitoring fluid and electrolyte imbalances pretty closely and anything that's prescribed medication-wise. Now, chronic kidney disease, again, we're treating the underlying conditions. Maybe there's medications that we can give to slow the progression and just support the kidneys themselves. Now, diet management is going to be fantastic for renal failure, like low protein because it's really hard to filter out protein. Proteins are big cells, and low sodium. Also, very specifically watching for potassium. Too high or too low, we can have some pretty serious cardiac arrhythmias, and then monitoring for anything else. Now, end stage, we got to go straight to dialysis, transplant, preparing them for a transplant, and just educating them on this is the end stage. We really can't do anything else for you, but let's see how we can move forward with dialysis plans and transplant plans. There's a little bit more information about urinary retention and kind of how we assess, things to consider, and how to treat it. But yeah, let me know if this video was helpful for you, and let me know if you're in nursing school and you want another concept explained.